for nearly $1 trillion in health care cuts for working families. And you can bet Medicaid will be one of their biggest targets. It's absolutely outrageous. And it's important that we shine a light to the American public so they know what is going on. Right now, the Senate is considering the nomination of Robert F. Kennedy, Jr. to lead the Department of Health and Human Services, who has made it clear that he will be a rubber stamp for Donald Trump, even if it hurts Nevadans. This isn't fear-mongering or speaking in hypotheticals. Donald Trump has been coming after critical health care since his first term in office. Every annual budget proposal Trump had in his first term, from 2017 through 2020, included huge cuts to Medicaid. And when Republicans in Congress tried to repeal and replace the Affordable Care Act, President Trump was on board with every plan they came up with that slashed Medicaid in the process. And I'll tell you what, Democrats stood up to him every time. But even after multiple failed attempts, it doesn't seem like President Trump has learned that Americans don't want him to roll back Medicaid. His Project 2025 manifesto calls for the Centers for Medicare and Medicaid Services to impose lifetime caps on Medicaid. What does that mean? That means a person can only receive Medicaid benefits for a limited period of time, no matter their income or their health care needs. That would leave about 92,800 Nevadans who are low income and depend on Medicaid for health care at risk of losing their coverage. We know RFK Jr. will just let this happen if he becomes the Secretary for Health and Human Services. Now, HHS oversees the Centers for Medicare and Medicaid Services, which means Mr. Kennedy would have control over what happens with these essential health care programs. Now, what's ironic is that Mr. Kennedy doesn't seem to even know the difference between Medicare and Medicaid. He confused the two multiple times during his confirmation hearing before the Senate Finance Committee. And also during that hearing, he made it very clear to me, and he made it very clear to the general public who was watching, that he would refuse to even tell me he wouldn't be a rubber stamp for this administration, that he could have an independent thought and fight for any harm that would occur to Nevadans or across this country. He would stand up with them. He made it very clear he would not, that he would stand with Donald Trump. Now, I cannot support someone who would let Donald Trump give his billionaire friends tax cuts at the expense of Nevadans' health care. And I know some of my colleagues on the other side of the aisle have argued that their plan to cut Medicaid is about getting rid of waste and fraud. Well, listen, I'm all for reducing government waste and fraud and streamlining our bureaucracy. I will tell you, I served for 8 years as the Attorney General in the state of Nevada, and during that period of time, the Medicaid fraud unit was in my office. And we prosecuted and we went after individuals and we held people accountable for that waste and fraud in the Medicaid program. So I am all about addressing waste and fraud. In fact, I know that my Democratic colleagues and I have offered to work in a bipartisan way to cut wasteful spending. Instead, however, Trump and Republican leadership want to gut Medicaid, which millions of Americans depend on to access health care. And it's just wrong. But let me talk about why. Let me tell you a little bit about the history of this. Medicaid was created in 1965 as a way for the federal and state governments to provide health care coverage to low-income people who need it. That includes children, pregnant women, seniors, people with disabilities, and adults across the United States. It helps veterans, new moms and their babies, rural hospitals, primary care providers, mental health care workers, and more. And as of June 2024, 788,481 Nevadans were enrolled in Medicaid and its initiatives like the Children's Health Insurance Program, or CHIP. And nearly 800,000 people in Nevada, and that's just Nevada, depend on Medicaid to keep themselves and their families healthy. This includes 1 in 6 adults, 3 out of 8 children, 4 in 7 nursing home residents, and 1/3 of people with disabilities. 43% of our births are covered by Medicaid. But here's the deal, 66% of adults in Nevada who benefit from Medicaid work for a living. So I cannot say enough about this program and its impact in my state and how important it is. You know, people over the age of 65 and disabled rely on Medicaid for their long-term care. And people with disabilities rely on Medicaid for their long-term care. Let me say, there are seniors who helped build this country and make America what it is today. They worked hard, they raised their families, and they contributed to our economy. And some are veterans of our armed forces. And now, in their senior years, they have chronic illnesses. And they aren't able to move around the house like they used to, but they cannot take care of themselves alone. That is what Medicaid is for. In Nevada, 17,600 Medicaid enrollees used home and community-based services and long-term services to support themselves. That means nursing facility care, adult daycare programs, home health aid services, personal care services, transportation, and supported employment. It is a common misconception that Medicare and private insurance covers long-term nursing facility care or home care. They just don't. That's Medicaid. And that's what Donald Trump and Republican leadership and RFK Jr. want to cut. To thank our seniors for everything they've done for our country, they want to roll back the health care benefits that are giving them the dignity that they deserve in their retirement. But that's not all. Medicaid also supports low-income children and working families, including pregnant women and children with disabilities. Nearly 40% of all children in Nevada are covered by Medicaid and CHIP. This is a crucial program for Nevada's kids, making sure that they get their annual checkups, their vaccines, the hospital emergency care, dental and vision care, and the medications that they need. All of this is key to ensuring that our kids grow and they develop at a healthy rate. Now, Medicaid also covers more than 40% of all births in Nevada. In 2023, that was 13,206 babies and their mothers who had access to essential health care that they wouldn't have been able to afford otherwise. These are the children, babies, mothers who are now being targeted by Donald Trump so he can pay for tax cuts for the ultra-rich. Another key component of Medicaid coverage includes people with mental health challenges and substance use disorders. Nevada Medicaid provides screening and early intervention, outpatient and community services, crisis and emergency response, and residential and inpatient treatment to children and adults. Now, I know we have a mental health care crisis and a drug epidemic in this country. I see it. I hear about it from Nevadans every single day. I think both Democrats and Republicans agree that we are just not dedicating enough resources towards Americans' mental health. And when there's a shooting at a school or a place of worship or a music festival, the first thing I hear is that we need to invest more in mental health. And families in both red and blue states are being torn apart by fentanyl and other dangerous drugs. So why do my Republican colleagues want to do Donald Trump's bidding and slash Medicaid, making this crisis even worse? They are working right now to pass a budget through Congress that guts these critical programs. And they want to confirm Mr. Kennedy, who we know is going to go along with every one of Trump's plans. If they succeed, what's going to happen is Nevada's working families, our seniors, our veterans, and our children, what will happen to them if Medicaid is slashed? Well, let me just tell you what's going to happen. In Nevada, we rely on federal funding for the vast majority of our Medicaid program. Without it, policymakers in my state will be forced to cut coverage and leave hundreds of thousands of Nevadans uninsured without access to affordable, quality health care. I've said it before, nearly 800,000 Nevadans will be in danger now, who have Medicaid now, will be in danger of being kicked off their health insurance. 17,600 seniors and disabled people in Nevada will be at risk of losing their coverage, leaving even more families with nowhere to turn to take care of their elderly loved ones. When Nevadans lose their coverage, the already expensive cost of health care shoots up. Now, Nevada HealthLink has a list of costs for people without health insurance. Let me tell you what that looks like now if they were no longer to have the benefit of Medicaid. Mammograms will cost $212 now. Brain MRIs have a copay of $20 to $100 with insurance, but it will become $1,000 to $5,000 without insurance. A visit to the emergency room will cost Nevadans who are insured a $50 or $150 copay, but Nevadans who don't have insurance could pay as much as $3,000. A baby's visit to the doctor for a wellness checkup costs $10 to $30 if they have insurance. But without insurance, it costs about $95 per visit. These are the kinds of costs the average Nevada family cannot afford to pay. But Donald Trump is threatening to make this a reality. If Donald Trump cuts health insurance in Nevada, even more healthcare providers may be forced to close up shop because their patients can't pay for their care. And let me just stress this even more. Nevada's rural hospitals rely heavily on Medicaid. If Medicaid is cut, these hospitals that are already understaffed and overwhelmed would have to reduce their services, if not shut down entirely. Now, that is not unique to Nevada. Every rural community that relies on Medicaid is going to have the same problem. And if you know our rural communities, you know that this is very rarely is there access to health care in a rural community. And when those providers are there, that is a place for our rural Americans to go. And sometimes they have to drive, in my state, 2 to 3 or 4 hours just to get access to health care. If we take away those areas and the location for health care in our rural communities, that will devastate rural Americans. And the reality is, in Nevada, we just don't have enough providers in our Medicaid program. It's one thing to have a clinic to open that door. It's another to have a hospital to be able to open those doors to communities. But if you don't have the providers, that's essentially shutting down health care for individuals and people across this country. Now, I will say my state is working to build out networks and encourage providers to come to Nevada, but we can't do it without critical funding from Medicaid. And if Donald Trump cuts Medicaid, one of the first things my state will have to do is cut payment rates for healthcare providers, which will make our shortage of providers even worse. And it will disincentivize providers coming to live and work in Nevada. And the ripple effect that will have on my state's economy will be disastrous. We just can't let this happen. This is going to affect Americans in every state across the country. We have to come together as a Congress and protect our working families from Donald Trump's billionaire tax cuts. And that includes voting no on RFK Jr., who Trump handpicked to lead HHS because he knew that Mr. Kennedy wouldn't do a thing to stop him. And with RFK Jr. running our Department of Health and Human Services, it's not just Medicaid that is in danger. Trump also wants to dismantle the Affordable Care Act. As we all may remember, he has concepts of a plan to do just that. But let's talk about what that means. Before the ACA, if you were an adult with no dependents, even if you were low income, you had no access to Medicaid. Unless your employer provided health insurance, you had none. Now, thanks to the ACA, more people than ever before can get the health care they need. Over the last 11 years, that's amounted to 20 million low-income adults enrolling in affordable, quality health care coverage through Medicaid. This has been a huge gift to our economy. Think of it this way. If you were an adult who had a chronic illness that kept you from working, you didn't used to have access to health insurance. But because of the ACA, you can now get the care and treatment you need and get back into the workforce. The ACA has helped Medicaid support our workers to boost our healthcare workforce, and it's made us a stronger and healthier nation. But once again, Donald Trump wants to roll this expansion of Medicaid back and strip health care from thousands of Nevadans so he can pay for tax cuts for his elite billionaire friends. Well, I don't know about my colleagues on the other side of the aisle, but I have no interest in cutting taxes for the ultra-wealthy when we should be cutting taxes for working families. And here's how we can do that. Part of the Affordable Care Act provided tax credits for low-income Nevadans to make their health care premiums cheaper and help them afford their insurance. And when we passed the Bipartisan American Rescue Plan and the Inflation Reduction Act, we made those tax credits available to even more people, especially those who had been impacted by the COVID-19 pandemic. But now, those tax credits for hardworking families are set to expire at the end of this year. This would be devastating to Nevada families and small businesses. 11,000 Nevadans would lose their health care coverage. Nevadans who benefited from these tax credits would see their health care premiums go up by $2,000 a year on average. And 250,606 small businesses and self-employed workers in Nevada who qualified for these tax credits will see their premiums increase. I'll tell you what, my Republican colleagues in the majority now have a decision to make. Instead of letting these tax credits for working families and small businesses expire and throwing thousands of lives into chaos, they could renew them. This should be simple. Let's come together and prioritize hardworking families and small businesses over billionaires. That's what we were elected to do, and it's what the American people expect of us. We cannot give our country over to the elite, to the wealthiest people like Robert F. Kennedy Jr., who will do whatever President Trump wants him to do to our healthcare system. My Democratic colleagues and I stand here today and every day, ready to continue pushing back against Donald Trump's attacks on Americans' health care. Now, Trump can say whatever he wants about not touching Medicaid and making America healthy, but the truth is that he'll do whatever it takes to lift up his elite billionaire friends and then tell you it's for your own good. Robert F. Kennedy Jr., it will be just a rubber stamp for that agenda. And because of that, I will be voting no on his confirmation. And with that, Mr. President, I yield the floor.